na ina mpesa wo de me pa my prayer me power na yenko my prayer me power
courage in the Lord. Do not look at that situation. Do not look at that problem. Do not look at that dry land.
BCTV, impacting through the gospel.
Na ina mpesa wo de me pa my prayer me power na yenko my prayer me power
courage in the Lord. Do not look at that situation. Do not look at that problem. Do not look at that dry land.
BCTV, impacting through the gospel.
Na ina mpesa wo de me pa my prayer me power na yenko my prayer me power
courage in the Lord. Do not look at that situation. Do not look at that problem. Do not look at that dry land.
BCTV, impacting through the gospel.
Na ina mpesa wo de me pa my prayer me power na yenko my prayer me power
courage in the Lord. Do not look at that situation. Do not look at that problem. Do not look at that dry land.
Jumedie nimekuwa eso yasneni Bembeni Travel and Consult pese uti kwan kwa abrochi ope passport visa ni akwanto ho hihye biara enhwe baabia Bembeni Travel and Consult abama Bembeni wa ahomatrufo yiso 0244362445 ana hwehwe won echi akwan wo osu foriko mo sawo hwehwe infidie ni infidijuma akwa eyema automation biara hwehwe Free Automation Limited echi akwan wo amasamai ajen kotuku fra omo ahomatrufo ahomachufo yi so 050-493-9395. Woni Lighters Media indi inkita na wonya wonsam ho amanebo video coverage media ho hyehyeye graphics sound ne kika ho biara fra won wo ahomachufo yi so 054-817-9863. Also, we hear logistical services to say import and export, freight management, ne kika ho. Hwehwe Prisi Logistics a kwan wo Captain House, Sema Community 5, Room 3, Hand Catering Services a pair. And now fra won 0246-658-161 and now 0244-777-276. Eya your phone na wo ye. Abadin to and na enye. Tweben Decovast Enterprise. Na won siesie bia ho ma kama. Fra won wo 0244-260-080 and now 0243-60-2021. Hwehwe won a kwan wo Tema Community 2. Woni host office na edi enimhwe. Woka Decovast Enterprise a wagye wo so say it all with flowers. Wo eniswadi hunu se obabua onyame adwuma ama ahene animu atre na yebo enkwagye ho daru. Fa wo ho bedom aba partners. Fra won wo ahomachufo yi so 0243-804-676.
Hello, wonderful viewers. Good evening and welcome to Promise City TV Health Talk Show. I would like to sincerely apologize for the late start of today's session. We ran into a technical problem that was posing as a difficulty, but thankfully we've been able to resolve it, and that's why we are live now. So sincerely we apologize for the late start, but hey, we're thankful that you've made it and you had the patience to wait for us to join us for this special talk, which is on rabies, as this month has been designated by the World Health Organization as Rabies Awareness Month. Today I have with me a special guest who is not new to us. He's been here a couple of times, and today he's joined us again to discuss this very important topic. So before I introduce him, let me quickly run us through what PCTV is all about, and we'll go right into the discussion. So Promise City TV is a Christian channel, and it has a number of programs lined up to help us in our spiritual work as well as our physical work and our well-being, our health. And that is why every Sunday we bring to you Health Talk on this same channel. So on Mondays in the evening at 7 p.m. is the Bible studies. Wednesdays 7 p.m. same time is exhortation hour with our sister RABIES. Then on Thursdays at 4 p.m. is inspirational hour with Pastor Jessica. In the mornings from Monday through to Friday is visitation hour at 11 a.m. with no other than our mother, Apostle Mrs. Bernice Ajimai Prempe. So if you have time around any of these times where the programs will be held, do join us and you will surely be blessed. Promise City TV is part of a bigger ministry, which is the Promise Land Faith Ministries International, and the general overseer and founder of Promise Land Faith Ministries is Apostle Mrs. Bernice Ajimai Prempe. And so I would like to take opportunity to say thank you so much, Mommy, for this initiative, having Promise City TV and all the programs that have been lined up for us to help us grow spiritually, physically, mentally, emotionally. I mean, the total well-being. Thank you so much, Mommy, for doing this for us. So for Promise Land Faith Ministries, we have in-person meetings every Wednesday at 10 a.m. at the Faith Temple located at Tema Community 1 behind the Goil Filling Station is Faith Hour on Wednesdays. Then every Friday is a manifestation half night at 9 p.m. Same Faith Temple at Tema Community 1 behind the Goil Filling Station. Then on Sundays, we have two services. In the morning, victory service is held at the Faith Temple at 9 a.m. Then in the evening at 6 p.m. is another service, but held at the Victory Temple located at Ashiama Atadeka. Then the last Friday of every month, we have a special all-night service held at the Dominion Temple at Doyum, that is off the Shy Hills Akosombo Road. That is where you would find us. So please feel free to join us anytime you find yourself in this vicinity for a wonderful and a blessed service. And don't come alone, please invite someone to join you. Okay, so let's quickly run into our discussion for today. As I mentioned earlier, this month has been designated as Rabies Awareness Month for those of us who don't know. And so I have a special guest with me in the person of Dr. George K. OSAFO. He's a veterinary doctor. He'll tell us a bit about himself so you get to know him better. And then we'll zoom right into the discussion. Okay. So, Dr. Safo, thank you once again for joining us in the studios. It's always a joy to have you here.
Yeah, thank you for having me, Abigail. Thank you.
Okay.
Yeah.
So can you tell us a bit about yourself, who you are, then we'll go into the discussion for today.
Okay. So as you said, I'm a veterinary surgeon.
Okay.
That I work at 6th Street Veterinary Limited, and I'm also privileged to work at Central University as an adjunct lecturer. Okay. Today we're going to talk about rabies, and it is something that I've dedicated time to study and also to educate people about as best as I can. So I'm very glad that I'm here today to talk about it.
Thank you. Thank you for joining us. I mean, while we were trying to resolve the technical issue we had, we started our conversation, and I must say that this talk is very important. Someone would say, oh, rabies is about dogs. I don't have a dog. There are no dogs in my community. Why bother myself? But from the conversation we've had, we shouldn't take it lightly at all. It's a serious public health concern that needs to be talked about. A lot of noise should be made about, not just noise, but we should be well informed about this. I hear it's one of the most the deadliest in the world, one of them, and yet it's most preventable. So can you tell us what exactly is rabies? I mean, most of us might have heard, but don't know exactly what it is, or we are just relying on hearsays, or ASA. Can you tell us, from your perspective, what is rabies?
Yeah, thank you. So rabies is a viral disease that affects all mammals. Every mammal can have it. When I say mammal, that means any animal group that have fur or hair can have rabies. And as you rightfully said, it's a very deadly disease. I think it's part of the number 1 to 10 deadly disease in the world. And
1 to 10?
Yeah, between the 1 to 10. I think the last match I was 7th, but you can confirm that. But the thing is it's very preventable, as you said, because over 99% of cases are transferred from our friends and furry friends, our dogs and our cats. So it's very preventable. It's something that when you vaccinate your pet for, you are going to prevent it from your community and from your house. Rabies affect us through the saliva of these animals. So it's not just biting. Bite is one because it's directly, the saliva is directly in the mouth of the dog, yes. But another way is scratch, because dogs usually pow themselves with their hand and all that. So when they scratch you with the saliva on their hands, you will see that the virus will be introduced into your bloodstream, and that also can get you to have the rabies virus. So from dog scratch and dog bites and even licking of open wound, if the dog has the rabies virus, please, it's very important. It's not that all dogs that lick you will give you rabies. The dog has to be infected with the rabies, and then when he does that is when you can also get either bite, scratch, or even licking of your open wound. So that is rabies. Another thing you can talk about when it's very crucial about rabies is when you get it and the signs start showing.
That's in the human?
Yes, in the human, even in the animals. The time limits are different depending on sometimes where you are bitten and all that. And I'm sure as we go on, we'll talk more about that. But when you get, the main thing is when you get bitten and the signs start showing, there is no known cure for it. There is no medicine you can go and buy that can solve the problem, or no treatment. There are some treatment, but there are Hail Marys. There are people who try to combine a lot of things, but there's no one treatment that you may say that the doctor will prescribe something for you or give you an injection that will cure you. If the signs start showing, it's mostly a straightforward pathway to the grave. So that is why we keep talking about this, because it keeps spreading and we try to end it as soon as we can. That is why we want to talk about rabies today.
Wow. Maybe because I've been previewed with the conversation we had earlier, so but this is really serious. That there's no cure.
Yeah. It's no cure at all. No known cure.
Wow.
So the only thing that people have, doctors, is what we call the Milwaukee protocol. But that combines a whole lot of things just to stop the progression of the virus. But not just to kill it, no.
It doesn't.
There is no cure for the virus. Yeah.
So how, okay, you mentioned cats as well.
Yeah.
We live with these pets. So aside cats and dogs, what other animals again within our environment can easily be infected and transmitted to humans?
So as I said previously, rabies is in all mammals. I think I have seen personally in practice rabies in a goat for myself.
Whoa.
Yes, we saw that in I think in Kumasi. And but it's when we talk about rabies, as I said, the bite, introduction of the saliva into the bloodstream of the human beings is usually have to have an open wound. And that is where the bites and then the scratching come in more. So that's why almost 90% or 99% of rabies transfer are usually from our cats and then our dogs, because they are canines, they have the teeth to be able to penetrate through your skin. But mammals every mammal can transfer. That means if I get it, my saliva gets to you, can get it. If goats get it and all that, but it's not that popular or common than the dog transferring it to the human
so
being.
human to human is not common.
It's not that common,
with
but it doesn't exist. It means that if a human gets it and you have an open wound and the saliva gets there, if the human being is showing the signs, you are definitely also going to have the rabies virus. So it is, you have to just be careful. Yes, but we concentrate on the dogs and cats because over years and over studies, it is them that have spread the virus more than any other mammal. Yeah.
Okay. I'm a bit curious about the goat incident. Did you investigate to find out whether it's from a dog bite?
Yeah, so if I remember correctly, this has been some years.
Okay.
So I may not remember correctly, but it was bitten. Like, see, they roam about. They have this extensive.
So it's a stray.
Yeah, they roam about to eat and then come extensive kind of keeping of the goats.
Okay.
So as they go and another dog came, attacked them, tried to get them bit, and then after some I think weeks, the goats started showing some signs of rabies. So the way we confirmed it, I think at that point they did a lab after they slaughtered to be able to check. I wasn't there for long. I was in my housemanship, so after that I left. But the one thing that the goat showed was hydrophobia. That is water, difficulty or painful, difficulty in drinking water. So we essentially just put water, and for the whole time was just running back when he just saw the water, just going backing up and all that. And that's what gave us the idea. But I know that they slaughtered it and they tested. I didn't get the diagnosis, but with all the other signs, the biting at inanimate things, the salivation and all those ones, yes, it looks like it was rabies. Yeah.
Okay. So still on the goat issue, I'm a bit curious about that. Is it likely that it would have transmitted to the other goats that it was in the same vicinity with?
As I said, it's in the saliva. The virus load is in the saliva. It has to replicate, or when you say replicate, it has to reproduce itself in multiple times. And it does that in the brain. So when it does that in the brain, it comes into the saliva. That's why it's most potent. So if you're going to get rabies, it has to be a contact with the saliva.
Okay.
And the contact of the saliva has to be on an open wound. So if the goats like this who do not usually bite, but because of the rabies they might, but usually they don't bite.
Yeah.
The saliva, if it gets into your bloodstream, or if you have an open wound, then you can get it. But if it doesn't, there's no bite, there's no open wound, then you will not be able to get the rabies. You can just wash that off
And
you're fine.
okay.
Yes.
What's of their feeding?
The trough and all that. So the viruses usually do not stay outside the body. We call them strictly intracellular. That means that they depend on cells in the body.
Okay.
That's why the transfer has to be from a life to another life.
Okay.
So
even if it's, let's say, the saliva coming from the infected animal on the feeding trough, and another animal comes in, and it's not likely.
Yes, it's not like because he will ingest it. It will not go the blood. By the time it gets to the HCl and all the other, before it goes, it has already been.
Okay, so we are looking at it being introduced into the bloodstream.
So that it can move. You see, the blood pumps to all the parts of the body, so it moves from that point of ingestion or bite to the brain, which is the actual center of replication.
Okay.
So if you get there and then it starts replicating, then you
can
have
start manifesting.
Yes.
Okay.
Please.
So with this process that you've just described, it applies to all mammals with the spread.
Yes, please. Every mammal that gets bitten or gets in touch or gets licked or whatever is the cause of the rabies virus, it goes through those replications, goes to the part of the brain, starts replicating or reproducing itself, and then it comes active in your saliva, which is the main point of the transfer.
Okay.
So every mammal will go through that. Yes.
Okay. And you touched on briefly about the symptoms. Can you give more on that? Okay.
So the symptoms of rabies, they first of all it differs because we have two forms. Well, three forms in some cases, but the main is the two forms. The two forms are the aggressive part and then the paralytic one. What that just means is the aggressive means that then the dog that you know, maybe Bingo is a very nice dog, and that you care for and all that, will now start becoming overly aggressive to everybody. He doesn't recognize his friends, he doesn't recognize any of the family members, becomes very aggressive all of a sudden. Then he starts now biting at all inanimate things. Dogs usually will not, maybe if they eat grass for another reason, but this one, wood, metal, anybody, even you the human being, will start coming after you. Very, very aggressive. Salivation, that means a lot of saliva, and that's the thing about rabies. He also wants to spread itself, so the saliva will become
production becomes more.
Yes, so that you can have most of the load in that saliva to be spread to other mammals so that it can survive. So the saliva, then you get to the aggressive saliva, then we come to the paralytic one. So the paralytic one is the one that has been known to cause most of the transfers, because the dog is just weak, paralyzed. You think the dog is sick. But unfortunately the dog is not sick. It's because of the virus that's causing that kind of symptoms. And that one is one I've seen myself. That one too was housemanship. I saw an old woman who brought in a younger dog and a very small puppy, and when she came, she said the dog is sick, he's not eating, he's salivating a lot, and he's down. So when we saw it, we noticed that something is wrong. So we asked the questions, the history, sort out if he has been vaccinated or not and all that, and he wasn't vaccinated. He just got a dog. Apparently she didn't even know there was a vet around, so she was trying to feed the dog and the dog bit her. So when she came, she was actually carrying the dog in a pan, and this is an old lady. And so when she came, we convinced her, explained things to her, and then we did euthanasia. That means we put the dog down. And then we took the brain sample and tested it, and the fluorescent test, and it was very clear, rabies positive. So we had now the pain to come and explain to the lady what was the problem. So this is why we tell you that you can prevent it. It's very preventable. Do not let it get to the point where you now come and hear that unfortunately your pet that you have has given you this deadly virus and there's nothing that you can do about it.
Wow. This is serious.
Yeah, it is. It really
Without
is.
cure. And you can't tell. By the time, sorry, you notice symptoms, it means that there's a serious replication up there, and there's nothing that can be done about it.
Yeah, for the
and
dog,
unfortunately, if you might have been scratched, known or knowingly,
exactly,
you have been infected.
you see, that's the thing. The thing is that even when the replication is not complete, it's not in the saliva, yes, you might be scratched, but at that point maybe you don't have, but you see the signs around it, every science is not perfect. So we just want you to prevent it. We don't want it to get to the point where it now has to be a guesswork. Do you have it? When did they scratch you? A day before it started showing this? You see, it's a whole lot of unknowns. But if you just do the right thing and you vaccinate and you do, and we talk about more of that, then you'll be able to get your family and your community safe.
Doc, please now tell us about the prevention, because we know there's no cure and it's this deadly. So what do we do?
Okay, so the best thing you can do for yourself and your family with this kind of virus is just to vaccinate your pets. The rabies is 100% preventable. Just vaccinate your pets. You see, if you vaccinate yours and then your neighbor does and another neighbor does, then we call something herd immunity, where most of the dogs in the vicinity are vaccinated. We want all of them to be. But if you take it up to yourself and you do it, then most of them are vaccinated. Then we do not have the point where a stray dog or even a feral dog will come in and introduce the vaccine, because most of them are already vaccinated. So they have the protection against it, that even if they are bitten, they can still fight the virus. So just vaccinate your pets. That's the best you can do for yourself. Because you see, there's a lot of, okay, it bit you maybe a day before the signs started showing, doesn't mean you have it. It bit you maybe when he went out, the dog maybe escaped, went to a fight, came with scratches, and then that day he bit you. It doesn't mean you have it, or doesn't. Do you get it? You can't tell.
There's so many uncertainties.
Exactly, and this is deadly, 100% death if the signs start showing. So it's the best thing is to just vaccinate your pets. Do it yearly. In Ghana we do. Some people do it every 6 months, but in Ghana we do it yearly. Yearly is accepted. When the dog is 3 months and above, you just do it. Before the 3 months, you don't allow the pet to go out to mingle with other dogs. When you do your rabies vaccination and you want the pet to walk and go, you can do all those other things. And this keeps everybody safe. Simple vaccination.
Simple vaccination.
Yeah.
All right, people. I hope you are enjoying the discussion. Don't let it scare you. I mean, that's why he's here, to give us the right information that we need. This is rabies we're talking about. And from what he said so far, is one of the deadliest amongst the top 10, but most preventable. How do you do it? Get your dogs, your pets vaccinated. My next question to him is about the cost of vaccination. How much does it cost?
Okay, so the vaccination is, the cost differs about where you are, but it should not be more than 80 cedis. Even some people, it's 20, it depends on where you are. So it varies, but it's very, very affordable. We make it that way, though we have to, import and other things. It's still made that way so that at least every single person can get the vaccination. And if you get a dog and a cat, which you should know that you are going to feed this dog, you're going to feed this cat. You should know that if that is what is going to happen when you get a dog, you're going to invest some money into that. So if you just invest the money into the dog you like, the furry friend you adore, by protecting him or her and also your family, I think that amount is very affordable and very, very important for you to spend, no matter the situation you are in. And as we go, we'll talk about the chances where everybody can even sometimes get it without any payment. But it happens in a time-based. I'm sure we'll go into that.
About that. Yeah. I mean, talking about the costs, let's say it's 100 cedis. You can save up 10 cedis every month.
Yeah.
Which I believe is affordable if you have a dog and you're feeding the dog at home. And within a year, you should get 120 cedis.
Yeah.
So, and the vaccination is once a year, right?
Yes.
You come in once a year. I think it's doable.
Yeah.
It's doable. We shouldn't give ourselves an excuse compared to such a deadly disease that there's no cure.
Yeah.
And you might have to spend a whole lot, and at the end of the day, you still lose your life.
Exactly.
If not you, a relative, your spouse, your children, nephews. Coming to the various people around these pets, I think we should know about that. We should protect them. So please, if you are here, invite someone to join. You can share with the share button, like the program and share so that others can join in and also learn about this important topic. I see a question there. Is there a remedy or cure? Okay, we've talked about it. The remedy or the cure for rabies. There's no cure, there's no remedy. So the best thing to do is to get your pets vaccinated so that they are secure. I'm just wondering, if I have a pet at home, this pet is not allowed to go out at all. So I decide, okay, I don't want to do the vaccination. Is it likely that this pet can be infected? Is it possible?
Okay.
I don't allow it to go out. It's always at home.
Yeah. So, you see, when we get these questions, we always say it's in the nature of the dog, rather, to always try to mingle with other dogs. I don't know if you have seen that before, but anytime you go outside, you see that if a dog, even in our clinic, if a dog comes there, some other dogs who want to come in, there is always that mingling. So if you are saying your dog will never go out and you have kept it in, you pick the dog, you go for walks. If you're not going for walks, that's not actually a good way to keep a pet.
Okay.
So you go for walks, you do all these things. You never know. I've even seen cases where it's not rabies per se, but the dog was attacked by other dogs in the community, which caused a lot of wounds just because they were going for a walk. So you can't say your dog is always inside, so you will not vaccinate. There is a probability he can even escape through the gates and go and come back
without you noticing.
And the dangerous part of that is, when he does, he has no protection. So because he has no protection and he goes and comes, if there's any fight or even a scratch or even a lick on an open wound, and dogs always have open wounds, they are scratching themselves open, and if there is any then that means that he gets infected coming back straight home. And since he's at home and he's not going anywhere, you are the next person in line to get it.
So to be safe, once a year, just get your dogs, your pets vaccinated.
Yes.
And that saves you. Okay. Before we talk about the various people within the communities around our pets, how effective is the vaccination in preventing rabies?
Okay. So when you give a vaccine to the dog, it takes at least, let's say, 2 weeks for it to show what we call antibodies. Antibodies are just the vaccine. When you even get bitten by rabies, right? Your body tries to fight it, and it fights it with that antibodies. So the antibodies are released to go and attack what we call an antigen. It's just some words, scientific words I'm mentioning. So it attacks the rabies, which is an antigen. So it just grabs it, makes it inactive, so that you don't show the signs of the rabies. And that's like the simple explanation for that. So if you vaccinate the dog, in the 2 weeks time, the body produces enough. We call it a titer. That means it has to get to a point where it can handle the protection. Because if you vaccinate and you don't get the antibodies, then you are not getting any protection for the dog. So this is why even sometimes with the rabies vaccination, your dog can be very sick. We'll tell you that, okay, let's treat that sickness first. Because we want to give the vaccine so that the vaccine will create that antibodies. But if the immune system
is already down, there's no
down,
way
then you can't do that.
Exactly.
So you try and treat that thing, make sure you are fine. Then we can introduce the vaccine to make sure that when we do it, we are sure that there is a good protection, and so that you are safe too.
Okay. All right. Thank you so much, Doc. So it's the Rabies Awareness Month. Is there something you're doing, like a giveaway?
Yeah. So for this rabies and hopefully the subsequent ones, we are doing a free rabies vaccination.
Okay.
That's why I was saying that sometimes the cost even doesn't have to come in because it's free rabies vaccination. You don't have to pay anything.
Is it every year?
That's what I'm saying. We are hoping subsequently.
So did it happen last year?
Yes, it did happen last year.
Okay,
Yes.
and we're having it again this year?
Yes, but in this year, they're having it in different forms.
Oh, okay.
So they're having some in Pond, Katamanso, with the government vet, and then 6th Street Veterinary, where I work. Okay. Management and the team and everybody, we thought it wise that in Dawenya we have not done that in a very long time. I mean, when we asked we are doing this with the district assembly, Lingol Pampam district assembly, and when we found out it's been years, 15 years that I think more that they have done the vaccination like in that vicinity. So we thought it wise that we will join up with them and then we'll do a free rabies campaign where we will vaccinate all dogs and cats in the vicinity of Ningo, Pampam, and then Dawenya. Okay. So the places are Dawenya Town Park and then St. Joseph, Pampam, and we're doing it on the 27th of September. It's free. All we need you to bring your pet. You will learn about rabies. We will have people who will teach you about a little bit about rabies. We'll give you some tracts, and then we will give your dog or your cat free vaccination. Record it, make sure you have it, so that you don't, if anything happens, you can show that your dog is vaccinated, everything is done. So we are doing that on the 27th of September, and we want everybody who is around that vicinity to show up, because we do not want the death that rabies causes to happen to anybody. It is a very merciless death, and you won't wish it on your worst enemy. No, so we should, everybody involved should be hands on deck. Bring it. If you just one day, if you are going to go to work or something, just come in the morning. We start at 8, and then we close at 2. So just in the morning, if you are going to work, you can even come around. Just do it before,
quickly, and then
because it's very, very important. We need to get this under control.
All right. I know when you talked about the vaccination for the Dawenya community, I was going to ask, is there a tag that you put on the pets to indicate that, but you mentioned the card. The card. However, I mean, I think there should be a tag on the pets so identify. That it can indicate to anyone that, okay, this pet has been vaccinated. Yes.
So the tags are usually will be done, but you know, dogs, the scratching, rain, and all the other things will wash that one off our hands. When you have the card, so in the card we don't just give you a card or a certificate. What we do is we write the dog's detail. We see the dog, we identify the dog, we look for your location, where you stay, your name. We take those details to make sure that the dog is vaccinated. But even apart from the just tagging the dog, what makes our hearts and what makes us sleep at night is that surely that dog has been vaccinated. And then we are reaching a herd immunity where we will know that at least that community is protected. It's very, very important. That's what will make us sleep at night, knowing that at least we have done something worthwhile.
Okay. Yes, so each vaccinated mama has a yellow card. Like we also get one. That's what's running through my mind. I would keep smiling. Yes. So the dog gets a yellow card.
Get a card, yes, please. So it's a certificate. We will print it with the rabies sticker and then we'll package it nicely so that you can have it on you. You keep it somewhere safely. That anytime you just show that, oh no, this my dog has been vaccinated. Yes, please.
Let me ask this. Just in case, perhaps, is it possible that a dog might have been infected, but it still comes in for the vaccination? What happens? Does it work out something to help that dog? Okay. Or it doesn't have an effect at all?
So if a dog has been, first of all, it has been infected, it will not come for the vaccination, because by the time it gets close to any human, so the way rabies is, the aggression is so high that he will not even come into the community, because he wants to bite everybody. That is how bad it is. And so when we see a rabid dog, we put it down immediately. Gently, we just make sure that we have put the dog down, so that we make sure that we have disinfected the area very properly. Then we take the sample to confirm, because we see the signs and then we have to also make sure that we have confirmed, because the confirmation is important because of the area. If you confirm it, then you know that okay, this area has, because the dog will definitely go and bite other dogs. So you know that this area has it, so we need to make or pay more attention to that area. Yes. So for a rabid dog to come for the campaign, it's not probable. Yes, it's not probable at all.
Wow. So then it's the, in quotes, obedient and calm ones that will follow you. Will follow you for the vaccination.
Yes.
I'm also thinking about the cats.
Yes.
How do they get their cats? Cats can be stubborn.
Yes, they can.
How do you bring them in?
Okay, so we have on that day we'll get some cat cages. We'll get some handling tools to handle them and all that. But we just need you to bring them around.
How do I bring my cat?
Okay, so what you can do is you can just put the cat in a very container. Can be a box. You create holes around it, and then you sellotape the top.
Okay,
just
so it doesn't
come out. Then you just create the holes for it to get oxygen. Then you just come. When you come there, then we'll figure out how to bring it out, vaccinate, and put him back again. Yes.
Oh, cats.
Yeah.
Somehow I just don't.
Yeah.
I'm not a fan of cats.
Yes.
I like dogs, but for cats,
They can be tricky because the developed world, they have more of how to handle them with their bags and carriers. If you have that, excellent. You can, of course, bring that.
Our environment has trained them not to be that cooperative. So
I know.
I'm just imagining how you can bring your cat in for vaccination.
Yes, you should try. Cats too, because cats get most of the aggressive nature of rabies.
They're already aggressive.
Yes,
they can't be aggressive.
Then they will get. You can imagine that aggressive cat gets overly aggressive. You can't handle that one.
Not at all.
Yes. So yeah. So we need you to bring all of them. Cats, dogs, bring them. Yes, please.
Bring all of them, please. Did you hear that? For money nabra, I'm saying I can't go for baby.
Yes.
Ejamwa Kramai.
Yes, bring
please
them.
Bring them. The flyer is out there. Free anti-rabies vaccination campaign. Go and learn more, and go, most importantly, get your pets vaccinated, please. And we hear me pa, because there's no cure. Prevention is better than cure. But in this case, I've nearly spoke French. There's no cure. C'est n'est pas cure. I hope no one arrests you for this French. Please, there's no cure. So please, 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 please. Knowledge is power. We've gotten the knowledge today that the vaccination is important to get your pets safe and you too safe, because once you're infected, sorry to say this way, you are dead. And trust me, I don't think you want to die at this age. You're not ready to go yet. There's a lot ahead of you. So please, let's keep ourselves safe by vaccinating our pets. And thankfully, again, it is free. Just locate them. The flyer is out there. Look at the information. Then you go pram and then Dowenya, right?
Yes, please.
Different times. The whole month. They are vaccinating. Please make time.
The same day.
The same, okay, it's actually the same day. So 29th for Dowenya, and then 29th is for Katamanso municipality, sorry. And then 27th for Dowenya Pram. Please make time and take your pets there. I don't know, can they do a walk into your vicinities as well for the free vaccination? So
after the vaccination we do, you see is on the flyer, we know that from 29th to the 4th October, if you come to the hospital you can get it. You can get, but on the 27th, we are doing it at those stations. Those stations, okay. Yes, so they have, after together that, with the campaign, so I get to know more. Any questions that you may have, you address it. Exactly. Okay. So from the 29th to when you come to the clinics, you can get it. Okay. So please, let's make time. The same way we take care of ourselves, take care of our family. I mean, we count these pets as family. So let's make time for them so that they can be healthy. Then we'll also be healthy. Me, I'm scared for anyone to get infected. As it stands now, I don't have a pet. I love pets. I love dogs. But as it stands, I don't have. But then I should be concerned about the ones in my community. So going back to the campaign you're having, sorry. What of the stray dogs? What and the stray pets around?
How are you going to get them vaccinated?
Okay. So it will surprise you that all the stray dogs have owners. So we
so they are actually not stray.
Yes. So we call them community dogs. That means that the community, they feed from the community, they get access to food, water from the community. So they all have people who are owners, but the fact that they don't go back home or they like to roam about. So what we do is that we are asking is that if you know that your dog, maybe Bingo is a roaming type, that
it's your dog.
Yes, you are still the dog owner. Please do so. When we see how it goes, and because the stray dogs, the danger is by the time you try and then go and handle to do the vaccination, you can either be bitten yourself, or they will just run into the bush or somewhere, or run into a vehicle, or all those things because they are afraid of
you.
But if they know a familiar person, you can just hold it. It's just the vaccination doesn't take time, so if you hold it just for some few seconds, we give the vaccine, then we are done. So at least you know that pet is vaccinated. Yes,
okay. Can you tell us just one myth, one peculiar myth that doesn't hold at all?
So I think one of the myths you mentioned, which is my dog stays at home every time.
Oh, okay, okay.
And then another myth is that what's the name? Some people think that rabies can be tested in their blood. Like maybe I feel warm. My dog licked me yesterday. I feel warm, so I might get What we need to understand is that the dog has to be infected. That is point one. If the dog is not infected, you do not have rabies. But the infection of the dog is where the questions come in. Have you vaccinated your dog? Is the vaccination still active? Has it passed? And all those other details. Because if you come let's say you don't know if the dog has been vaccinated, you don't know if the time has passed, then that means you're at risk. Exactly. Because there's no protection or lower protection. So therefore you have to know that if the dog has it, you are also going to have it. That is why the WHO says if anybody gets bitten, the idea, just to be safe, you should go and take the anti-human virus, but anti-human vaccination, that's anti-human rabies vaccination. But it's not too common. It's not cheap
as compared to the
vaccine for the dog. So it can go to a lot of charges can come in. So just do the first thing. Vaccinate the dog.
Which is less than 100 cedis.
Yes, just make sure that you have gotten that pet vaccinated. If you have done that, then you know that even if there's a scratch, there's a lick, there is a bite, unfortunately, you know that you are protected, and your family too.
It's also protected. Please, I mean, it's all about vaccination to keep yourself safe. So let's try as much as possible to get our dogs, pets around us vaccinated. Okay, there's a question here that still says, is the remedy or cure in the pipeline? Are there works going on, research going on to find a cure to it?
For the only research I know that is going on is the Milwaukee protocol that I told you about. That is a way that some people, I think there's one lady who got the perfect outcome. She was okay, she has given birth to twins and all that.
Wow.
Yes,
and
so she's clean. And that's what the Milwaukee thing started from, Milwaukee protocol started from. It's a way to cure somebody with actual rabies. But as I said, it deals with putting the person in coma, making sure that the brain replication is lowered. Sometimes they have to freeze you. It's a protocol. That's why it's a protocol.
That's a lot of money.
And the money, and even in our current setting that we have, I don't know what hospital can go through all that with you. So it's just do the initials. At least if you do the initials, you know that you are protected. You know your children. That is very important. Your children,
the kids.
Because the kids are the ones that always get close to.
Yes.
So the kids is very, very, very important. Dogs are supposed to be kids lovers. Some of them are, But because they are like that, the kids get the most. I think the cases, most of them will be it's kids that get it. So let's please be careful and do the best for our family by vaccinating our pets.
Okay. All right. I think you've touched on the kids. That's so how for them to be safe is to vaccinate the dogs.
Yes,
Then the kids can be safe around them. Yes. Again, someone's asking, how should they behave around unknown dogs in the community?
Yes. So when you see, especially kids, you see kids are fond of throwing sticks, stones at dogs. Maybe they think they are playing.
I've done that before.
Yeah. Unfortunately, I have done that before too. So yes, so they change these dogs with sticks and all that. So when you frighten a dog, there are two outcomes or two outflows from the dog. Either he runs or he attacks.
Okay.
Those are the two things. So when you change and he's running away, sometimes they can run to a point, turn and attack. So it's advised that when you meet a community dog, the dog has not. If the dog is not aggressive, has not done it, you don't
just
need to
walk away.
Just walk and go away. I don't know why people go out of their way to either step or throw aside, but just walk and go. And if you see that the dog's behavior has changed, and the way the change comes is either the tail will be straight down, and then he'll be growling at you.
Usually you have their tail waggling up.
That means he's friendly. That means he likes you. He's playful. But you see that the tail is down straight or in between the legs. That means he's afraid, and he's growling with the back hair standing up. It means that dog wants to attack. So that means you have to be careful. The way children, and this is to the children, if a dog is about to attack you and is growling, you can stand in a tree form position. That means that you stretch and your head will be down and you'll be stagnant. Because if you try to run, definitely you'll catch up.
No, but I'm scared. I'll definitely run.
That is you have to go against that nature of yours. It is not easy, but you have to, because if you run, he'll catch you. You can't run faster than the 4 legs. You are using 2 and he's using 4.
I actually did that before. Yeah. I'm just remembering the scene.
Exactly. The calculation should show you
it was by grace I escaped.
Yes. So the science that has come is that you stand straight like a tree, where your hands are by you and then your head. But if the dog attacks you, what you do is you curve yourself in a ball form. The reason why you are doing that is you are preventing it from attacking vital organs. Ooh. So you attack your legs and your hands,
your extremities, and then
you are okay. At least we can treat that. And even if the progression of the virus depends on where you are bitten. So if you are bitten here at the chest, you know that it's easily. If you are bitten on your neck, you know that it's easily. But when you protect all those sides, your head tucked in, your hand, your legs in like that, like a ball, he bites those parts. Somebody at least will help you, and then he goes away.
Parents, I believe we are learning, and then senior brothers and sisters, let's train. This is like a drill. You could take it as a drill at home to train the kids how to handle themselves in case they find themselves in any such situation. So that's it about the children. I think the community, we've touched on that as well. What people should do if they notice any dog acting strangely. Yeah, I think we've touched on that. We've touched on the vaccination as well. Then those who own dogs, I believe we've done that as well. So for a dog owner, what does it mean to be a responsible one?
So a responsible dog owner is the one who, first of all, will take their pets to the vet for checkups, for injections, that's the vaccinations, then for just general welfare of the dog. That's a responsible dog owner. Because you can't say you are bringing a live animal, an animal who is living and breathing, and you are going to just give him food and water. You even buy, even if not anything, some people even buy herbal medicines for themselves. So at least you know that the animal needs at least a sort of medication. Can be a dewormer, can be whatever he needs, just know that he's not out of the bubble of healthcare. He needs healthcare. That's one. Apart from all the food and all the things, sometimes even the food you are not doing it as you're supposed to do it, and so the vet visit will really profoundly help the dog, for you and even the owner to know how to take care of the dog and how to make sure the dog is not suffering or the cat is not suffering or your pet is not suffering. So healthcare, if you prioritize healthcare as a dog owner, then you're a good dog owner. That is one.
Okay. Yes. Thank you very much. I believe today we've learned a lot about rabies, and we now know that the sure way out is to vaccinate our dogs, which costs less as compared to treating yourself, which has no cure. In the end, you're going to lose your life. So it's best to have your dogs vaccinated. Thank you so much, Doc. I think our time is up and we have to run now. Other than that, there are a few more questions I would have asked, but I believe that this conversation has cleared a lot of doubts and concerns that we had about rabies. We've talked about the kids handling themselves, dog owners, the community. So you shouldn't say, oh, I don't have a dog. Oh. My community, there's no dog. Oh. Yeah. So you shouldn't be unconcerned. You should be very much concerned about that. And any advice you could offer. Now we've learned, probably a friend, a co-worker hasn't heard about this, just knows about rabies, knows about vaccination. But with this level of information we've gotten today, we can spread the word. That's creating the awareness this month. So this month, be an advocate of, how do I put it?
Of the rabies
campaign. Yeah, rabies campaign. Be an advocate of the rabies campaign, and let's spread the word. This month, vaccination is free. Is it free in all other vet facilities?
Yeah, so if you saw the flyer, it is first in the Tama to the Punkatamanso City. That is one. That's from 28th August to 2nd
October.
Then the next one is what our outfit, that is where I work, and then the district of Ningo Prampram, and then the Gaprife, that's what we are all under as private vets. Yes, that's the next one. That's the one that we are doing it in Ningo Prampram at the St. Joseph Park from 8 to 2 in Prampram, just by the side of the ECG in Prampram. Then Dawenya Town Park is just opposite Eno Spot in Dawenya. So those are the two spots. We are doing it on the 27th. 27th of October.
Please bear it in mind, 27th
of September. 27th of September we are doing that. And after that, we will be continually doing it till the 4th of October.
In your clinics?
In the clinics, yes.
Okay, so here we're talking about Tema municipality. What of other regions as well? Are there vaccinations, free vaccination going on there?
Yes, so different places have different way they are handling it. I can say for the Tema region, but I know in Kumasi, Vet Ada is a group of doctors. They're also doing some in Kumasi.
All right.
Yeah, so it's different places that are doing
how
their
they
own
have arranged
campaigns.
Yes.
And
Okay.
that. Yes.
Okay. But the whole idea is try and get your pets vaccinated.
Yes, please.
And doesn't cost much.
Yes, please.
So as much as possible, if you can, if it's not too late, let's see, you can go to a veterinary around you and inquire about it and then get your pets in there to be vaccinated. Tell your neighbor to tell a neighbor to tell another neighbor that this is what is going on. Rabies is not curable, very deadly, but then there's good news. It's very preventable. Very preventable. How do you do that? By getting your pets vaccinated. And it costs not more than 100 cedis. Can you compare that to the life you're going to lose? Should you be negligent about it? I know your answer is no. So let's do very well and get our pets vaccinated. They are safe and we are also safe. Our children will be safe, our family will be safe, the entire community will be safe, and Ghana as a whole will be safe as well. Thank you for joining me today, Dr. OSAFO. Thank you so much for making time to join us today and educate us extensively. Now, should I confidently say I'm a... Let me not go there. I'm an advocate.
Yes, you are.
I am an advocate now, an expert at that.
Yes.
With the knowledge I've gained from my friend, Dr. Safo, today, I'm most grateful. And special thanks to your boss and your management for allowing you to join us today. Boss, I salute you. I know you are on the call listening to us. Thank you so much for lending us your expert to educate us today. I believe you've learnt a lot. Don't keep it to yourself. I keep going around it. Don't keep it to yourself. Let's share the information. Be an advocate. And let me add this to it. God will richly bless you for doing that, for sharing this knowledge with others.
Amen.
Yeah. So before I go, quickly, let me talk about our programs on the channel and also acknowledge our sponsors, and then we're out of here. So on Mondays is Bible studies online at 7 p.m. right here on this channel. Then Wednesdays 7 p.m. exhortation hour. On Thursdays at 4 p.m. is inspirational hour with Pastor Jessica. And Sundays at 4 p.m. is health talk. Once again, we sincerely apologize for the late start. We had a huge problem we had to deal with technically, and thankfully it has been resolved. And thank you for having the patience to stay with us throughout this conversation and discussion. Okay, and also on Promised Land Faith Ministries, we meet on Wednesdays at 10 a.m. at the Faith Temple, Fridays at 9 p.m. for manifestation half night at the Faith Temple, Tema Community 1. Then on Sundays in the morning, 9 a.m. is Victory Service at the Faith Temple, Tema Community 1, behind the Goil Filling Station. Sundays in the evening at 6 p.m., about to start soon, is the second Victory Service at the Victory Temple located at Ashiama Atadika. Then the last Friday of every month is an all-night service, a special one where we encounter God. And that is at the Dominion Temple located at Dojum of the Ishai Hills, Akosombo Road. You can call the numbers on your screens for more information about any of these programs if you want to attend them. Now to our sponsors, we have Benbeni Travel, and they handle all travel documentations. So it's travel and consult. So they will consult for you any information you need regarding the travel outside the country. They are there to help you out. And you see the passports there. Please, if you don't have one, call them right now. Don't waste time. Call them right now. You can also visit them at Osuforiku Mall and they will sort you out. We also have Frobe Automations, and they are into roofing, block making machines, construction, batch plant, installation, servicing, repairs, modifications of all of these machines, all automated machines. They are located at Amasaman, Ajinkutuku. Their number is also on the screen. You can call them and they will attend to you. We also have Lightest Media. If you need any photo shoots done for you, photography, videography, any event at all that you need this done for you, if you need t-shirts branded for you, items that you need prints on it, just name them. It could be a recording, a TV, just name it, an advert done for you. They are there to handle you. They have their numbers on the screen. Call, WhatsApp, Facebook, Instagram, you name it. Just reach out to them and they will attend to you as well. We also have Decovas Enterprise, always ensuring that our studio is well set up. And so if you have any special events coming up, don't hesitate to call them. They'll handle it classically for you. It could even be an office event that you need the place decorated, dinner, weddings, parties, surprise parties. Just call them. They are located at Tema Community 2, opposite the Community 2 post office. Their number is also on the screen. You can call them and they'll get right to you what you need. ABBA Partners, Apostle Bernice Ajimai Prempe Outreach Mission. You can call the number on your screen to be part of this initiative, and it's all about salvation. It is all about salvation. So call and be a partner now. I think last but not the least is the Crash Makeovers Beauty Parlor. So if you need your makeup, your hair services, wigs, revamping or new wigs done for you, kids hair braiding, pedicure, manicure, anything beauty, they are the right people to contact. Their number is on the screen, so you can call them, and you can also locate them at Mataiko Afenya Road. Okay, so if you also need to advertise your program, you need to advertise any products or services as well, kindly call the number on your screen, 0243804676, 0243804676, and you will have your products or services advertised for you on this channel. Okay, so all too soon, it's time to call it an evening, and it's been a joy to host you on this show and to host my very dear friend Dr. Safo, who has been a blessing to us this evening. I can't thank you enough for making time to join us. So until we meet again, same time next week, this is Health Talk on PCTV, and I've been your wonderful host, Abigail. See you. Have a blessed evening.
Yes, Lord. I am not talking about creation. Jesus. I am talking about creator. Amen. Come on, are you hearing me, somebody? Yes. Are you hearing me, somebody? I want you to connect to the grace. I want you to connect to the grace. Tonight, minima the swabia with the bar. But you are true say. Me was swollen me so for so many years. Ali komu pon ombra Christo nchen abamana home internet me. I carry presence of God into ene wonyankopon be nyame na ne ma nyinshira me senya yate be yewate na ne ma be nyinshira ujidi akasa I hear you. This ujidi akasa I hear you. Holy Ghost. And now you are not by your thing. They may pray for people who come and Musama me. Wakuma pen me pe. Onyamu here wakuma. Wakuma pen me pe. Answer the radio somebody anybody home enemy kasa. Blessing. Be perceive baby sound engineer. Be do microphone so na me come nyame a. It me come style be teacher come or something here. On distract me. Tiene here. Owaha. Tiene bekani. Na ye wieni abom paya. Na person nya wotia matua. Untone ba. Onyamere ne sabeka. Utina ha. Ukọ baabi embere bia echo. Na ukọ pemwa. Na de na ukọ cheye no. When what de na answer da amfa. It's personal who say no afa personal nkobu. Ade ni dunya. Ena na dwane wo ha say obe break sa covenant no. Na ode oje e bia ma. Ti say de bom paye. Na wo ameka se na me wo kusun ene me kasa. Say utina ha e ma me free hanko. E ma de ni kusun ni wona. Be so ko pa bi ko pemwa. Na ade ni de na bi yusu wo ade na amfa. It's personal who say no franco. E we say dem pen me send to me anka. It's one for personal nko. Ade ni kutia. Obon sama dey for free. But deliverance is passing by. Someone say, I don't know tonight. I'll put down for eternity. Please. Put down for. Please. Put down for eternity. Eternity. Put down for eternity. Eternity. Put down for eternity. Eternity. The permanent. Put down for. 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 Put down for eternity. Eternity. Put down for. Put down for eternity. Eternity. This your life. Hey, loose fire. Loose fire. Loose fire. Loose fire. Maybe I will one day. Maybe I go in feast. I had this kind of madness too. And we say, I will down for. I will jump ranting it. Was I will jump it? But I planted in a canal, separate. And you know what this year, Mama, so that you was a Kajanaka. When I go post around, stop sleeping too much and intercede for your children. Because God has blessed you. And this was so I was like, I'm a school, a coaching, because you're so many concern, or you're only son. So many concern. In the spirit of madness, it was. I want to see Mary. Now, who's a Satan in the Indians? But you can't sit under my grace and go. Never. You can't sit under my grace and go out. Stop sleeping too much. You can sit for your children. I disconnect you from any call.